So let me get this straight. This is a long sentence. We're going to be gifted with a health care plan we are forced to purchase and fined if we don't, which purportedly covers at least 10 million more people without adding a single new doctor, but provides for 16,000 new IRS agents, written by a committee whose chairman says he doesn't understand it, passed by a Congress that didn't read it but exempted themselves from it, and signed by a president who smokes.
He passed the Affordable Care Act, a goal strived for by presidents starting with Teddy Roosevelt. It required him early on to use up almost all of his political capital. He prevailed where no president had done before. He was right. He was right. It cut $100 billion. $100 billion from the federal debt over the next 10 years.
With funding administered by a Treasury chief who didn't pay his taxes, for which we will be taxed for 4 years before any benefits take effect, by a government which has already bankrupted Social Security and Medicare, all to be overseen by a Surgeon General who is obese and financed by a country that's broke. So what the blank could possibly go wrong?
What's the good? Well, 67,000 people are now enrolled in pre-existing conditions insurance plans. 3.1 million young adults were insured because they were allowed to stay on their parents' insurance as a result of the Affordable Care Act. 20.4 million women gained free access to preventative services, including mammograms, cancer screenings, and prenatal care. That's all good. 105 million Americans no longer have these lifetime limits on the benefits that they can be reimbursed for by their insurance company, and $3.2 billion saved on prescription drugs that were previously in the Medicare donut hole. That's all good.
Providing access to affordable health care to 30 million Americans, 8 million black Americans who would never have had insurance.
As you might imagine, I disagree with the Supreme Court's decision, and I agree with the dissent. What the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare. Let's make clear that we understand what the court did and did not do. What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy. Obamacare was bad policy yesterday, it's bad policy today. Obamacare was bad law yesterday, it's bad law today. Let me tell you why I say that. Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations.
Here are the details that every American needs to know about this plan. If you are among the hundreds of millions of Americans who already have health insurance, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. They will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or in a lifetime. We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. I will not sign a plan that adds one dime to our deficits, either now or in the future. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system, a system that is currently full of waste and abuse. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance. The time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together